So good morning everyone. Today we'll discuss about something called an interesting topic called fisher tongue. So as you know, all you have seen so many different type of tongues. So like tongue, there are some diagnoses only depending on, they are made only depend on tongue. So for example, if you have in anemia, if you have the paler tongue, so it is a very paler tongue directly goes diagnosed towards the anemic condition. So in the same way, there are some vitamin deficiencies like vitamin B6 and B12 deficiencies, all the vitamin B complexes deficiencies. So you directly diagnose depend on the tongue examination only. So today we got one interesting patient that there are actually she is having some syndrome called as that syndrome I will discuss later, but there are some normal conditions which are there in clinical practice. I want to discuss that. First, you only one thing in any patient of fever, if they come to hospital, every doctor will say the tongue. Why they are more interested on the tongue? Because tongue is like it's an index to diagnose some diseases. It's like a mirror image of the disorder. In patient of typhoid fever, if the patient is having coated tongue, so directly if the coated tongue and if the patient is all the having symptoms towards the typhoid fever, so directly goes towards the typhoid fever. In the same way, if the patient is nutrition deficiency, if the patient is having worker of like grain workers and sugarcane workers, they are already in the deficiency of some nutrients. So in this patient, their tongue will diagnose this condition, because there are so many patients who came to hospital complaining of generalized body weakness. They will come. There are some vague symptoms. What are the vague symptoms? Vague symptoms are nothing but depending on those symptoms, we unable to diagnose the conditions. So these are called as vague symptoms. Like if the patient is having, some of the patient is having, I am getting some lower limb weakness and like sciatica type of features they will have. But on examinations, if you do MRI scan everything, their sciatica is not there. Like there is no any indentation to the nerve. So that's why in this patient, what you have to do is, if the patient is having complaining all these things, you have to retrogradely see for the tongue examination or any vitamin deficiency examination. We all know that all nerves involves for all nerve generation there will be a need of vitamin B12 deficiency. In the same way, if the patient is having deficiency of B12 deficiency, so those patients may have some generalized vague complaints. So what are the vague complaints? Same myalgia and neuropathy symptoms. So in these conditions, what I want to do is, depending on the clinical examination only, we have to see all from head to toe. We have to do general examination from eye, tongue. I am discussing only tongue. I just stick on to the tongue now. So tongue examination directly goes towards in vitamin B12 deficiency. What are the criteria? Some patients are having something called geographic tongue. What is mean by geographic tongue? They will be having having multiple blackish patches over the tongues. Though some geographical tongue, they are symptomatic, some are non-symptomatic. What is mean by symptomatic? Symptomatic means they will have some burning sensation, they will have some stomatitis which are full burning sensation, unable to take the food. If they are having the symptoms, we have to give some vitamin B12 support. So that's why patient will get normal conditions. So in this patient, she is around 65-70 year female patient. So she came to hospital with complaining of only generalized weakness. So only for the generalized weakness, we have examined everything. She is having all the signs of anemia. She is having pale tongue, everything. So one interesting during examination, we found that there is something called a fisher tongue. You can see this. Come close. You can see this much deep grooved fissure. You can see Gospel. You can see this. She is having a central groove. You can see. Madam? Right. Okay. So you can see that she is having a deep groove inside the tongue. So in this fisher tongue, so what is meant by fisher tongue? Fisher tongue is a layman language. In medical terms, fisher tongue is also called as lingua plicata. What is meant by lingua plicata? Lingua is nothing but a tongue. It's a tongue, medical term for the tongue, that is lingua. What is meant by plicata? Plicata is nothing but any cut. So because of the deep fissure or the groove, this is called as a lingua plicata. So this lingua plicata if it is patient is having asymptomatic, this is nothing to worry. If the patient is having what is meant by fissure? Like fissure is having, depending on the grooves and depending on the site of the fissure or the lingua plicata condition, we have to go for the diagnosis. Usually a non-symptomatic patients, it is a normal for the some patients. What does it mean? For whom it is normal? The patient who is having asymptomatic. What does it mean by asymptomatic? Asymptomatic nothing but patient is not having any pain, burning sensation and inflammation. And one more thing is, if the patient is having already a mild fissures. What do you mean by mild fissure? Mild fissures are nothing but a small grooves. It's like, you can see this. You just assume that this is a tongue. You can see in between the small grooves. They are not opening, but they are having some grooves. You just think that this is a tongue and these are the small grooves. If the patient is having lingua plicata with this tongue with minimal features, it is asymptomatic. If the patient is having central, this is a tongue. If the patient is having only grooves and fissure in the central, it is called as linear central fissures. If it is having the peripheral, it is called as peripheral linguata. So there are so many conditions. Clinically there are much importance, but still you have to see if the patient is having a deep grooves. If you are having this much deep groove as how the Ajji is having, if it is having, you have to see some important syndrome called as Melkersson Rosenthal syndrome. What do you mean by Melkersson Rosenthal syndrome? If the patient is having all the clinical features of same fissure tongue with Bell's palsy. So as we are examining everything, this patient is not having any features of Bell's palsy, and she is having one features of some condition is called. You can see her lip. You can see a swollen lip. You can see this. Her swollen lip. This is persisting since 1 year. Not a 1 year, many years. This is swollen lip with masked face. Nali torsri. You can see the deep grooved fissure. Okay. So this overall condition is called as Melkersson Rosenthal syndrome. So this syndrome is having some it is like unknown thing for so many people. So what is the importance to diagnose this condition? By taking this much, yes, we learned everything. Melkersson Rosenthal syndrome is there. Yes, it is there. But what you have to do? If it is there, means what is the next step you have to do? If the patient only for the treatment purpose, it is very important. As we know that this patient is not having, what are the complications of this condition? So complications nothing but if the patient tongue is having groove, if any this fissure, if you have any food particles, if it is stasis, that is the food particles are trapped in between the groove, that will cause some inflammation. Because of the inflammation, there will be severe swollen tongue and patient will have severe pain, tenderness and swelling. So because of this condition, patient will have chronically reduced not taking food. Because of the chronically not taking food, as the patient is having groove with a trapped food inside, they will call inflammation, tongue inflammation. Because of this condition, not taking food, they will cause a severe anemic condition. If the patient is not having any food, there will be a deficiency of nutrition deficiency, and the patient will have anemia. So this patient is presented to the hospital with generalized weakness, but her HP is only 3. So what you have to do is, she is having all these symptoms since years together. So because of, she is actually for HP, like for anemic condition, we have to think whether this anemia is because of this condition or any other condition. Firstly, just leaving this condition, we thought that anemia may be because of any blood blood losing disorders. What are the blood losing disorders means? She may be having hemorrhoids, there is bleeding hemorrhoids. She may be having fissures, there is bleeding fissures, and she may have some blood vomiting. Nothing is there. She is not having any features of losing bloods. So she is quite normal, and she was working in the farmer, in the field she used to work. So because of only this lingua plicata condition, she is having reduced taking of the food on and off every 15 to 20 minutes. She used to have whatever she is taking, that food is trapped in between these fissures. So because of trapping, they will cause severe inflammation. It's called a poor oral hygiene. Because of her poor oral hygiene condition, that tongue will cause severe inflammation. As she is having inflammation, she is unable to take food. Her condition goes like she is not at all taking any food. Because of this chronically not taking food, she may have developed this anemic condition. So one more thing is, for these fissures, there is no treatment. So only treatment is which can try is, we can give the full dose of all the B complexes. Mainly a vitamin B12 complex have to be given with a full load. And one more thing is, you can try with some steroids. First you have to correct the anemia by giving blood, and next we have to give the vitamin B12 injections. Next thing we have to do is, we have to give with some steroids conditions. So some steroids, selected steroids to be methylprednisolone to be selected, but I don't know how much it will help. But only for treatment purpose, what we have to do is we have to treat her anemia, and we have to see her tongue, and we have to give some large dose of vitamin B12 complexes. And this is a case. Thank you.